I want to take a moment to introduce some of our upcoming courses. This Wednesday, April 1st at 12 p.m., we will have the impact of safe patient handling legislation in California, presented by Dr. Suzanne Lee from the University of California, San Francisco. This Thursday, April 2nd at 12 p.m. Pacific, we will be hosting this webinar again, Protecting Workers in the Service Industry During the Coronavirus Pandemic in Spanish. And next Tuesday, April 7th at 12 p.m., we will be presenting creative use of direct reading instruments with Dr. Thomas Peters in partnership with the Heartland Center for Occupational Health and Safety as a part of our monthly NIOSH Education and Research Center Industrial Hygiene Series. For more information, please visit us at coeh.berkeley.edu/aboutce. On behalf of the Center for Occupational and Environmental Health, I would like to welcome you to our webinar, Protecting Workers in the Service Industry, by Alejandra Domenzain and Suzanne Teran from the Labor Occupational Health Program at UC Berkeley. A few housekeeping items first. You will need to be muted during this presentation. If you would like to ask a question, please enter it into the online chat or Q&A. We will save time at the end of the presentation to address all questions. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health's YouTube page and on our website, coeh.berkeley.edu. All participants who logged in with their registration email will receive a link to the recording and an evaluation form that will qualify them for a certificate of completion worth 1 contact hour. At this time, I would like to present our presenters. Alejandra Domenzain is Program Coordinator and Suzanne Teran, the Associate Director of the Labor Occupational Health Program, or LOHP, which is a part of the UC Berkeley School of Public Health. They both focus on addressing immigrant workers' health and safety and developing effective strategies to improving working conditions. LOHP's mission is to promote safe, healthy, and just workplaces. Thank you for joining us.
Thank you, Jessica. This is Suzanne Teran, and thank you everybody again for joining us on this webinar on protecting workers in the service industry. An important aspect of managing the COVID-19 pandemic is, of course, making sure workers are protected. And today we're going to be focusing on the service workers who are doing jobs in a variety of industries that have been deemed essential and keeping many of our systems in place and our access to food and other needs during the response to the pandemic. I wanted to mention that today, that we're going to be repeating this webinar in Spanish on Thursday, and we will share a flyer at the end with more information if you know people who would be interested in that version. But before we begin, we want to get a sense of who all has joined the call. So we invite you to take a moment and answer the following poll and let us know which industry you work in or represent. So I'm going to leave a few moments. If you could please just pick, you can choose more than one answer, but let us know which industry you work in or represent. Great. Do we have poll results? Okay. Excellent. Okay, good. So we do have a mix of a variety of different service industries, a lot of health and safety professionals. I know we're all sharing resources and strategies right now and learning from each other. If there's another industry and you want to add that on the chat, please feel free to do so now. I see there's like a quarter of the people come from another industry. So thank you again for being here today. Oops. Oh, there we go. So as Jessica mentioned, myself, Suzanne Teran, and my colleague Alejandra Domenzain are going to be presenting the webinar today. I also want to mention our director, Laura Stock, is going to be helping us with the chat function and with the question and answer period. So you'll be hearing from her as well. As Jessica mentioned, our mission is to promote safe, healthy, and just workplaces. And a focus of our work is to build the capacity of workers and worker organizations to take action for improved working conditions. We support workers and worker organizations in a variety of ways, from participatory worker training to developing educational materials in different formats, languages, and literacy levels, to participatory research with workers and communities, as well as adding a public health lens on policy analysis. So here you see examples of some recent headlines, and there is certainly growing attention and concern for the many service workers in the essential industries, including those, as you'll see here, in delivery or retail, including groceries, janitors and postal workers and domestic workers. These are just a few examples because we're certainly seeing a lot of this, not only in the media, but we're hearing about and seeing concerns from workers who are facing health and safety challenges at work. So the webinar today is designed for workers and worker organizations mainly, and really, as we said, it's going to be recorded and the slides will be available. Please feel free to share it with other workers or to use the slides. This is really a resource for anybody who finds them helpful. And I'd like to first review our objectives for today. As it says on the slide, today you'll be learning about the ways that you can be exposed to COVID-19 at the work site, what your employer must do to protect workers, and what you can do to reduce your risks. That's a big focus of today's session. Also, because one of the key recommendations is to have increased disinfection at the workplace, we do want to have some discussion in objective number 2, which is that you will learn about the health effects of common disinfectants, what your employer must do to protect workers from chemicals, and what you can do to stay safe while cleaning or using these disinfectants. And lastly, you will learn about the key rights that protect your health and safety at work and what steps you can take to take action if your employer is not protecting you or if you have other concerns about the level of protection at your work site. I want to acknowledge that we are all still learning about this new virus, and in terms of worker protections, today we're going to be sharing some of the practices and suggestions that we and many others are sort of brainstorming and coming up with to be able to institute some of the recommendations from CDC and guidelines from federal agencies at the different work sites. The bottom line is that it is the employer's responsibility to provide a safe work environment. Workers, we know, play a very important role in making suggestions for your specific work site and also raising concerns based on what you're experiencing there. So today we're going to share some ideas and strategies, and we hope that you can then apply them to your work site. And at the end, we're going to give some resources and links for resources because we're also in an ongoing basis adding to those. So let's start with a quick review of some of the basics. And I want to start by asking you again, we're going to have two true and false questions, and you'll see a poll come up. So the first question is please answer true or false to the statement, the virus enters your body only through the eyes, nose, and mouth. So we'll give a second for the poll to come up. Is there a poll up? It's not appearing in my screen. So I want to double check if participants are seeing it.
The poll is live. I'm not sure why it's not pulling up. It looks like people are commenting on that. So let me end it and relaunch it. Just one moment.
Okay, thank you, Michelle. No, there it is.
Okay,
So
there we go.
Poll, if you could please take a few seconds to put in your answer. And Michelle, whenever you see the responses, coming in. Please close the poll. Great. So 68% replied that it's true, and about a third that the statement is false. So let's take a quick look. I sometimes have a chat forwarding after the poll. Oh, there we go. True. So this statement, the answer is actually that is a true statement. The virus cannot enter your body through the skin, but only through the mucous membranes in our eyes, nose, and mouth. And that is why we are seeing so much focus on the recommendation to not touch our faces, because we want to avoid contact with our eyes, nose, and mouth. So another quick poll, this statement says the primary way the virus spreads is by people touching infected surfaces. Again, Michelle, if you could help us launch the poll and people can pick true or false.
My apologies. For some reason, this third poll isn't working.
Okay, maybe people can think for a moment of what your answer is, or if you wish to add it in the chat.
Okay.
And I will just move forward. So this statement is false. For those of you who picked false, we know, everybody, it can spread through contact with infected surfaces. That is one potential concern. But it is really it is mainly spread by being in close contact with another person. Really, that's why we have the 6-foot recommendation, not to be in close contact. In this slide, you see an image of how when someone sneezes or coughs in particular, there can be a lot of invisible droplets of saliva or mucus that disperse into the air. And so I want to note there has been increased attention to the fact that there was one study that showed that some virus was detectable after a certain number of days, on like 1 day for cardboard, I think 3 days for plastics, but it's still the primary way it's spreading now is still believed to be there's droplets with the virus going from one person to another. So now I want to hand it over to Alejandra, who is going to talk about how workers can be exposed.
All right, thank you, Suzanne. All right, so in the initial poll, we saw that people are joining us from lots of different industries. So we'd like you to take a moment and think, in your work site or in your industry, what are some ways that people are exposed, especially knowing, right, that the primary way is through people and secondarily through infected surfaces. And if you can type into the chat, what are some ways that you're seeing possible exposure? And since that's kind of a longer answer, I think I'm going to keep going and kind of talk about some of the categories of main risk factors while you guys type, and we will come back to your answers in a bit. So the first one and the main one is because the main route of transmission right now is person to person, it's people. So any time in your work that you have contact with people, and that could include coworkers, it could include clients and customers, and it could just include the general public. So obviously I saw in the chat that some people are from an airline industry. That would be a good example of where you're exposed to a lot of people. But, and all the customer service type occupations, obviously like retail, that is also a big problem. The second one is, even though it's not the main route, there have been tests that the virus is detectable in surfaces, as Suzanne mentioned. So you have to think about those surfaces that either a lot of people are touching or they're getting touched very frequently, or both. Obviously, the more people, the more touching, the more risk. And then lastly, for many workers, just getting to and from work could pose a risk. And especially if you're taking public transportation, right? Because that's increasing both just the sheer amount of people you're exposed to, but also the uncertainty about whether these people might be contagious, right? Because they're strangers, as opposed to, let's say you're carpooling with one other person that you know well regularly. And then in addition, in public transportation, you have a lot of common surfaces, right? If you see that bus with the railing, look at all the hands that are touching and changing every time people get on and off. And just lastly, just a reminder that workers who are exposed can then come home and spread it to the people that they live with. So from a public health perspective, it's really important to think not just about your own risk of getting the disease. Maybe you're thinking, oh, I'm young, I'm healthy, maybe it's not such a big deal for me, but the risk is also that you can transmit it to others. And that includes those that may be in a much higher risk category, such as basically anyone who's older or anyone that has a chronic condition, anything in the respiratory system like asthma or lung disease, also cardiovascular disease, kidney disease, and diabetes. And so we're going to talk later about some kind of practical suggestions for how you can avoid bringing the virus back home. Okay, so who is more at risk, right, in terms of workers? OSHA came up with this way of categorizing it, which I think is useful to think about. So at the very, very top of the pyramid are those with the very highest risk. And so those are healthcare workers that are having contact with these little droplets that we talked about. So when they're doing, you'll see the term aerosol generating procedure. So that's basically you're doing a procedure where your droplets might be coming out. So maybe you're intubating someone or just very close to their face when that can happen. Also lab workers that are working with specimens, right? So we have increased testing happening. And so that's obviously contaminated. And then autopsy workers of those that are known to have the disease. So those are the highest risk. And then still at very high risk are all the healthcare workers, just because they're dealing with those that are either sick or potentially sick, and then those that are transporting those workers, such as ambulance drivers, first responders, and then of course mortuary workers. Now in the medium risk, this is we said that the biggest risk was just being in contact with people. So anyone that has to come within 6 feet of those who are infected. So that's a wide range of occupations, or just anyone that's in contact with a lot of people, because we know that right now the primary means of transmission is community transmission, which just means, one person to another. And then of course, the lowest risk would just be those that aren't in contact with people that could be contagious, or just with people at all. So for example, if you're working at home with a stable group of people in your home, you'd be at the lowest risk. All right, so hopefully you've had a chance to put in the chat some ways that you see workers being exposed in your industry, or maybe you also just have some questions right now or some comments about routes of exposure. So I'm going to hand it off to Laura, who's going to bring up a few of those so we can include those before we go forward.
So far, there's been a number of people sharing ways that they get exposed in their work, from childcare workers to others. A couple of questions that have come up are about the routes of exposure, and one question is about whether people can be exposed through cuts in their hands, and whether or not this has been shown to be bloodborne, which my understanding of the research is that it has not been. But I don't know if you have anything you'd want to add more to that question.
Yeah, I also haven't heard about that route. So I did see in the chat someone talked about diapering, and so I have seen some studies where that's one thing that they're trying to look into as well, because there's some evidence that it can also be shed kind of through the fecal process. So yeah, that's a really good one to stay tuned to, because it's obviously very relevant. Thanks for the question.
Okay. So thank you, and we're now going to shift into talking about ways to protect workers. So first of all, we do want to again emphasize, or start off by emphasizing the bottom line, which is that the employers have the legal responsibility to provide safe workplaces, and there's a general duty clause that was part of the Occupational Safety and Health Act that says the employers, shall furnish work sites that are free from recognized hazards. In addition, in California, we have the Injury and Illness Prevention Program, or the IIPP, which has a very strong focus on prevention. And as you'll see in the top right column, there is a quote there from CalOHP that all employers must determine if COVID-19 infection is a hazard in their workplace, and if it is, implement prevention measures and training. So even absent a specific standard on this particular virus, employers under the IIPP in California do have to take those prevention steps. And I wanted to highlight that in addition with this standard, workers have the right to be participating in health and safety programs, making suggestions about health and safety issues and bringing up concerns, and to be trained in a language that they understand. So it can't just be, being given a leaflet in English, but really we are promoting effective training where there's participation, time for question and answer, but they do have to be trained in a language that they understand. Oops, sorry, I forgot to forward the slide. So what must employers do to protect workers under just some of the basic responsibilities under both the OSHA, which is the federal OSHA administration, and CalOHP in California? They have to identify the hazards and know how workers assess how workers are exposed. They have to develop methods to control and work to hopefully eliminate or at least reduce exposures. And as mentioned previously, they have to train workers, definitely when a worker starts in a job, but whenever any new hazards are identified or new work duties or products, such as disinfectants, come into the work site, they have to be providing training on how workers can be protected. So with that in mind, we are going to now look at what the recommendations are for protection from COVID-19, and specifically how that translates to the workplace. So for example, we've heard a lot about, avoiding close contact with people who are sick or with others, and just some of the recommendations. So social, or actually physical, distancing is seen as a key important recommendation to reduce contact with other people and to try to maintain that at least 6 feet of separation. Another part of the key recommendation is to clean and disinfect regularly, especially commonly touched areas, any objects or tools or surfaces that are commonly touched in the work site. Third, that we really want to support workers' access to regular hand washing, because we've seen over and over again the recommendation to wash our hands in soap and water for 20 seconds. Workers need to be able to do that, to have the time to do that, to have the reminders to do that, and to have the supplies to be able to do that, or hand sanitizer if soap is not available. A fourth recommendation, because we do want people to be able to stay home when they are sick, is to adopt policies so workers can do that if they have symptoms or if they are high risk, and to do so with compensation and without risking losing their job. That includes, I know the CDC is promoting being able to do that for workers who have to take care of another person in their family. And lastly, we want employers to be providing personal protective equipment such as gloves or whatever is deemed necessary in the context of that particular work site. So now I ask that you all work with us on one particular case study. And in this case, we're going to look at a grocery store worker. It's Julia's story. And I'm going to read it, and then we're going to think about recommendations for this particular case based on what we just reviewed. So for the past few weeks, the grocery store has been so busy. Julia says it's the busiest she's seen it in her 10 years of working there, and she and her coworkers have been working quickly to help customers and to also restock shelves and keep up with an inventory. So each cashier may check out over 200 customers a day, and the distance between the cashier and the customer is 2 feet or less. So thinking about that story, what are some ways workers like Julia could be protected? And again, think about the physical distancing, the need to clean and disinfect, regular hand washing, any policies to support if sick, and any needed personal protective equipment. And we ask if you could please add some suggestions into the chat. And then I'm going to ask Laura if she could read a few of the things that are popping up as ideas before we go on to summarize some recommendations.
I'm seeing gloves, masks, physical barriers, people setting markers on the floor to promote distance between customers and others, physical barriers, face shields and sanitizers and masks are some of the answers that we're getting.
Great, thank you. And those are, excellent answers and some of the ones that we have in the coming slides. Thank you for participating. So as we're using grocery and retail as a case study in this particular webinar, but think about, as you're looking at the recommendations, which of these could apply to your work site as potential ideas, because some of the tips and practices can be translated into other industries. So for example, Laura said some of you mentioned physical barriers, and in fact, some stores are starting to install plexiglass, for example, between the cashier and the baggers and the customer to provide that, that distancing and barrier. The photo that you see on the right is just one photo from a local store, and I think all of us are trying to understand how long do these physical barriers have to be truly protective, like to actually shield the whole site. But we wanted to share one example of something that we have seen. Limiting the number of people that come into a store, we're seeing more and more of that happening. So in order to have more ability to keep 6-foot distance between people, because you just have fewer people in the place. Some retailers are using order ahead and drive-through pickup, and that again minimizes the contact between workers and the public who's needing those products. Laura said someone mentioned having markings so people stay 6 feet apart, and you see that in the photo there, how one store installed that with tape to show where the 6-foot distance is. You can do this in places where there's people waiting to approach, in this case a register or in line, again encouraging that separation. Potentially using every other cash register, again to increase spacing, as well as encouraging the use of credit cards over cash or electronic coupons, really trying to diminish or reduce the amount of times there's any sort of exchange or interaction close up between the worker and the customers. I think Laura mentioned that there were also recommendations around disinfecting that were popping up into the chat, or cleaning. And we do want to have regular schedule with workers, hopefully assigned to that, rotating, but who are doing regular disinfection of the common touch surfaces. In the photo, you see someone doing that with a shopping cart, but we definitely want to also have the register areas and other places where workers are commonly being routinely disinfected. It's possible some retailers will need extra staff to do this, or maybe have reduced customer hours in order to be able to have the workers add these tasks. We do as well want to have, regular hand washing breaks and provide all the supplies. Suggestion that workers wash their hands really well before they leave work, and that once home, you change out of your work clothes and set those aside to launder, so that you're entering your home space with clean, fresh clothing. In terms of PPE, what's being recommended so far for most of these industries is really a focus on gloves. Non-latex gloves are better in terms of just avoiding allergies, but we want to make sure there's training on how to use and discard, but also recognizing that they still could be contaminated, and we have to remember all the washing and cleaning strategies. And to note that, again, we need to promote and adopt policies so workers know they can stay home if they have symptoms, and that there's no retaliation for needing to stay home or for asking for more protections. So those are some of the ideas, that we have been collecting or reading and talking about, reading about for the grocery and retail. And as I said at the beginning, many of these, particularly around like the cleaning and disinfecting and even in the physical distancing, can apply to different sectors. We wanted to use this as the case study today because grocery and retail is one example of a workforce where there is a lot of interaction with many people, from the community or general public. But we recognize that there's other industries on this call, and we're going to share a few tips for some other industries, as well as at the end, we'll have some additional resources, and we're available for, trying to help and consult after the webinar as well. So some ideas for distancing in other service sectors. I know there's been some questions coming from those who are in schools providing the lunches to people, still the reduced free lunch programs. So some tips there are to set it up so that the meals are picked up, but then are taken away and they're eaten elsewhere. So the interaction is shortened and it's just a pick up and go. Again, the idea to have the marking so people can stay 6 feet apart, having a drive-through system, maybe where people or the workers are giving meals to all the children in one vehicle and it's just a drive-through process, as well as being able to distribute at one time meals for multiple days so that it reduces the frequency of interaction. With workers involved in delivering, whether packages or food, again, staying 6 feet away during drop-offs or just leaving it outside, hopefully setting up so that the customer pays ahead and there's less need for an exchange or interaction. In childcare, there has been recommendations around limiting the number of children. Recognize this is a very difficult sector because workers who are out working, and especially many of our healthcare workers, need childcare to be able to do their jobs. But some of the suggestions are to, be having a stable group of children and caregivers so that we're trying to reduce exposure to a lot of other people, given who we already have in the group. And really having good communication with families and checking in daily with the parents or family so that children do stay home if they are sick and have symptoms. So really having that exchange and making sure families know what the symptoms are and to stay home. And finally, in jobs like warehousing or other where you have co-workers and you're all still working within a facility, and your coworkers are the other people you may be exposed to. There's the ideas of having staggered shifts or staggered breaks for common areas so that you really think about how to try to promote that 6 foot distancing in those instances. Companies may need to adjust their work output or expectations, but while still recognizing that we need to pay the workers for their shifts and work as usual, as well as thinking about how to reorganize the layout or design of the workspace to promote distance. So again, as I mentioned at the beginning, we're sharing practices and ideas as they're coming up, and we're talking with a lot of colleagues to brainstorm and then offer support. So we will keep adding to these, and we'll tell you at the end where to look for the resources. But now now we're gonna have Alejandra talk a little bit about personal protective equipment.
Thank you. So I see already in the chat, there's a lot of questions about PPE. So let's start with that. All right, so if you guys remember, think back to the pyramid that we talked about, right? And who was at highest risk and, high, medium, and low. And so at the very top, right, at the highest risk are healthcare workers. And so these are the two guidances that we have just, again, based on the science available so far, right, is that for sure healthcare workers need effective personal protective equipment, which is an N95 or other air purifying respirators, possibly other gear. And there's a range of respiratory protection beyond N95. There's plastic shields that cover your face, there's hoods, right? But healthcare workers absolutely need it because they have, the exposure very close to them. The other kind of solid guidance we have is that if you have symptoms, right, if you're someone who's coughing and sneezing and contagious or possibly contagious, you can wear a mask just to contain some of those droplets, right? So you're not sending it out, kind of spraying really broadly into the air, but you're trying to catch as much as you can in the mask. So it's really important with masks that there's different masks for different purposes. So let's talk a little bit more about some of those. First, the difference between a surgical mask and an N95 respirator. A surgical mask does not provide the person who's wearing it with protection from inhaling small particles. And viruses are tiny, tiny particles. So it is not considered respiratory protection. The particles can come in through the fabric itself. And also, if you can tell that the fit is kind of floppy, right? So there's some space on the sides, there's some space on the top that things can come in. So as a worker, if you're wearing a surgical mask, you are not protected from the virus. An N95, on the other hand, the reason it's called 95 in the name is because it is certified to filter out at least 95% of those particles, including the small ones. And when it fits properly, there's a pretty good seal around the face. And so, there's minimal space where particles can come in around it. And so that is a lot more effective protection for what we're talking about here. So really the other thing to consider besides the fit and the design is the material itself. So with a surgical mask, it's not waterproof, but it's kind of fluid resistant. And so mainly it's meant for, when there's things that are splashing near you, it catches some of that. Whereas again, the N95 is actually protecting you from the particles that can penetrate. And if you are in an industry where it is required to have respirators and you need them, then it's not as simple as just handing them out. The employer is required to have a respiratory protection program. And so this includes many things. These are some of the main ones. Is the employer has to conduct an assessment to see, okay, what type of PPE exactly do we need for this hazard? It'll be different for each workplace, how extensive the protection has to be. They have to do fit testing because, everyone's face is different. You may have facial hair. There's different sizes and brands and types. So you have to make sure for each person, it actually fits right for that person one by one. And then of course you need training and information. So you're wearing it properly, how to put it on and off properly, how to store it, how to make sure it's clean. You're switching out cartridges, that kind of thing. And then you have to ensure that there's a medical evaluation because someone might have an issue. Let's say they have asthma and it's not safe for them to wear that kind of mask. So you have to make sure that everyone's medically cleared to wear that level of protection. This is just to give you an example, like a couple of the things that you would look for with an N95, that the straps are placed in the right position, that it's fitting over your nose, but also under your chin. The little bar where you pinch has to be exactly suited to the shape of your nose. And then you need to test to see if when you're breathing, if it should be collapsing, which means it's, the air is not easily entering through the side. So cloth masks have aroused a lot of interest, and it's really so heartwarming to see that people, want to sew masks for themselves and for others. And, they're really thinking about the healthcare workers who are on the front lines and wanting to do what they can. And so we have to come back to the science in terms of giving recommendations. And so what we know, again, from the science available is that cloth masks are not protective for workers. So if you are in a work situation where you might be exposed and all you're wearing is a cloth mask, you are not protected because of what we talked about, that the small particles can go through cloth. There is no seal, right? And that fabric is not meant to keep out those small particles. And in addition, there's even some, studies that show that it could actually increase your risk because if you have a mask, all that moisture, right, all those little droplets are kind of concentrating there. And it's very frequent that, when you're wearing a mask, it's kind of sliding around or falling or moving. And so you're touching it a lot. And so now you're touching the place where all that moisture and those droplets are concentrated. And now it's on your hands. And so let's say then you fiddle with your eye, or then where you touch a surface that others are going to touch or someone else, then that could be a risk as well. So you shouldn't, if you're as a worker, it's a bit of a false sense of security to think that you're protected with a mask. Again, as I mentioned before, if you're someone that has symptoms and you're just concerned about not spraying things in the air, then it could be a help in that context. All right, so some people are also asking about gloves. gloves can be useful, mostly kind of as a reminder to not touch your face, because it's something we do a lot, all of us unconsciously. So when you have gloves, you're kind of more conscious of it. But remember, we're not concerned about the virus coming in through your skin. You don't absorb it through your hands. That's not the reason you're wearing them. And so the same way that your hands can get contaminated, those gloves can get contaminated. So if they are, and then you touch your eyes wearing the gloves, it's exactly the same as if you're touching with your hands, right? You're still gonna get contaminated. That's not gonna help you with that. So you should always assume that they are contaminated and not reuse them, toss them, change them frequently. Also wash your hands after removing, because if not, you have that same situation where now the same thing that was on the gloves is now on your hands. And the reminder about avoiding latex because of it can trigger asthma and also allergies in some people.
Okay, thank you, Alejandra. And now we're going to pause to see, Laura, if there's a couple questions or comments that you're seeing on the chat around this topic of protecting workers before we go on.
Yes, there's quite a few comments on the use of masks, and a number of people really looking for information about the difference between cloth masks and surgical masks, which our understanding is that surgical masks are made from more protective equipment than cloth masks, though they will not prevent you from inhaling the particles. One question came up about whether gloves can be disinfected, and I assume that depends on the material, but I don't know if you have any further information on that.
Yeah, I mean, we have seen different, that's a good question for us to follow up on. I mean, we've seen stuff around gloves like using sanitizer. I'm not sure though whether the soap and water recommendation is foolproof with the gloves. What I have seen as the strongest recommendation is for people to use them as disposable. And after a use, and really the employer getting enough gloves for that. Oops, hello?
Yes, I was going to, one other question that came up is back to the legal requirement for employers to supply N95 masks. And just to clarify that, as you mentioned earlier, that if there is a known hazard and masks are protective, and if that is a requirement that the employer identify what those hazards are and what the measures are to protect people, and then provide the personal protective equipment that is required. But if there's anything more you want to add on the subject of people's right to personal protective equipment, that would be helpful.
Yeah, I think it's a difficult question because people, obviously, we're all very concerned about that, and we're trying to assess. There's been the shortage for healthcare workers for the masks, and that's gotten a lot of attention, and hopefully there's going to be more action to actually get those for those workers. But as you say, in terms of workers' rights, it really is that the employer has to assess and look at the best recommendations. At the end, we're going to be linking to guidelines that the CDC, Cal OSHA, and OSHA are issuing and updating regularly for businesses. And so workers can look at that, employers can look at that to assess. You know, we're learning about the exposures and the virus as we go. Right now, as Alejandra said, the recommendations are for most workers to really be, you know, that the distancing is a really important thing, as well as the disinfecting and hand washing. There haven't been recommendations that everybody should be wearing masks as of now. Okay, thank you again for sharing questions. And we're trying to take, you know, a few as we go through. We're now going to be going on to the next topic, shifting gears a little bit, but still really relevant because, you know, as new products are introduced into the work site to do disinfecting, we want to be sure that workers are also aware of what the potential hazards are, and you know, that employers are providing what's necessary to work safely. So now we're going to talk a little bit about the health effects of common disinfectants, what your employer must do, and what you can do to stay safe while cleaning. So in order to fulfill this recommendation, we know that there's a lot of disinfection of commonly touched areas, which means, as I mentioned, that new products may be introduced. So first, let's just stop a minute to see, like, what are some possible health effects that might be related to disinfectants? And again, Laura, if you could read some of the answers that come in from the chat, I'd appreciate it.
So far, I'm not seeing any quite yet.
Okay.
I see allergic reaction, dermatitis, skin
Oh, good.
irritation,
Yeah.
rashes.
Exactly, exactly. Yeah, so those are some of the health effects that cleaning products and disinfectants can have. There's skin rashes or dermatitis, just like someone commented in the chat, irritation of the nose, eyes, and mouth. We're already hearing from some workers who are experiencing sort of burning eye sensation from using some of these new products that are coming in. But we also want to be conscious of the long-term effects of some of these disinfectants. And in fact, several ingredients that are often found in disinfectants can cause or worsen asthma. You see them listed there. It's basically sodium hypochlorite, which is in fact bleach, quaternary ammonium, and glutaraldehyde. And so those are three products that are three ingredients, chemical ingredients that are linked to respiratory issues. We also want to emphasize that to not mix products. I think the bleach and ammonia combination, people, that there's been a lot of coverage about how those products together can create a toxic gas. The same thing with bleach and vinegar, another thing. So really always avoiding mixing any products, as that can have fatal consequences. So which disinfectants to use when this is in order to disinfect the work site? First of all, there is a list that the EPA has, and you see the link there on your web page, on the PowerPoint slide, for disinfectants for use against this coronavirus. And so workplaces do need to look at that list and pick one of the products that's on there. And if possible, choose products that have, I just told you which ingredients are linked to asthma. So if possible, choose products that actually have the ingredients listed here, as they are not known to cause asthma, including hydrogen peroxide, products that have alcohol as an active ingredient, could be ethanol or isopropanol, or lactic acid or citric acid. Now, some of the hydrogen peroxide products sometimes come with what's peracetic acid, and we do want to avoid those. So it's hydrogen peroxide, but without peracetic acid. And I'll show you where you can look for this. The EPA site actually has a search function. And so you see there in the top right, we typed in citric acid on the search, and then you see some of the results that come up when you click into that. And so we've circled a couple of the products. Citric acid, for example, is in Lysol bathroom cleaner. Citric acid is in a Comet disinfecting bathroom cleaner as the active ingredient. And those are two products that are on EPA's list for what can be used in this case to disinfect the work site from coronavirus. So now we want to think about, okay, so we're using these disinfectants. What are some ways or work practices in order to be able to work more safely with disinfectants? And again, please add some ideas to the chat. And I'm going to ask Laura or Alejandra to read a few of the answers that come in.
Well, one thing I just saw that people were mentioning the importance of reviewing the safety data sheet that gives information about the specific nature of the hazards that chemical might provide. People are also mentioning using safety glasses and gloves and receiving adequate training on the product, and that there should be sufficient ventilation, as well as training on how and when that ventilation is needed.
Excellent. Perfect. Those are all excellent points. And those are some of the things that we want to keep in mind when using the disinfectants. I want to mention that it is important to clean the area first. This is not so much a health and safety tip, but since we're using disinfectants, we want to make sure they're effective and that we don't want to have dirt and dust on it. You can use detergent or soap, clean it first, and then disinfect. And as someone mentioned on the chat, open windows or other ways to be improving ventilation is really important. In terms of work practices, try to avoid spraying or spray products, but if you do, you can put it onto the sponge or rag directly and then use it so that less is going just into the general air and the breathing zones. Laura mentioned some of you were putting information about the label, and that's very important too. Labels give you, like, here's an example. It's actually a sodium hypochlorite or bleach-based product, but you can see there, you'll find instructions. One important thing is instructions for diluting. If the product is being diluted, you do not need to make it any stronger than what it says on the product, because the product has been deemed effective for coronavirus to be on that EPA list just based on what it says for dilution. So no need to make it stronger. And also it'll tell you how many minutes it needs to stay on the surface wet to be effective. And that's important too, in terms of, it's not just a quick pass necessarily. You do want to make sure it stays wet. But all containers should have a label, and that includes if you're taking it from a big, container onto smaller bottles for use. Please make sure to add the product name so others know what's in it. And Laura mentioned, several of you commented on gloves and eye protection. Really important. You can check the label, but really also the safety data sheets that were mentioned to see if there's specific PPE recommended. Again, as with the other parts, we want to emphasize that there is an OSHA standard that is the hazard communication standard that does require all workers are trained on new products that are being used in the workplace, how to use it safely, what the health effects are, how to protect yourself. They also have to have the safety data sheets. It's SDSs there on this slide, but that stands for safety data sheets that have a lot of information on the product and protection, and those should be made available to workers, and also emphasizes the labeling requirements. Are there any questions or comments on disinfectants before we move on to our last section?
A number of people are sharing kind of best practices, like somebody said, spray in mist to avoid making splash. Though, again, you want to spray in a way that goes directly onto your cloth, so it's not going into the air. There's some questions or concerns about when cleaning is happening and whether people need to be replacing the rag that they're using, or whether they need to, what happens when people are using the same cloth for cleaning different kinds of equipment. And I don't know if you have any more information on that. And there's another question about whether temperature can kill off the virus. I know I've read that it's very, it's not very hardy, and that heat kills it. And I don't know if there's anything more that you would want to add to that.
Yeah, I mean, I should mention that generally for cleaning, microfiber cloth is recommended. And I think you do want to make sure you're not reusing something to the point that you're using a dirty cloth, right? As I mentioned, you have to clean the surface first to remove dust and dirt, and you don't want your rag to be dirty and that it's adding dust and dirt. So hopefully there's a refreshing, of cloth, and certainly probably not using it for different products is another thing to pay attention to. On the heat thing, certainly ultraviolet light kills the virus, and there's actually some looking into hospitals to use that for disinfecting. I know the CDC is recommending, for example, trying to wash your laundry in warmer water, or as warm as possible. It doesn't have to be super hot, and then drying really well. But I haven't seen something that says absolutely heat kills the virus. That's as far as I know to date. Okay, so let's move on, Alejandra, with the next section on workers' rights and taking action.
Okay, great. Well, we've heard about what some of employers' responsibilities are to protect their workers. We're just going to cover a few more things in terms of workers' rights. So what I'm seeing in the chat is, a lot of people asking questions about, well, my employer isn't doing this, or do they have to do that? And what can I do if it's not happening? And so workers are absolutely protected to bring up health and safety concerns, to bring up hazards, to bring up injuries or illnesses without retaliation. And so there's actually procedures where you can, file complaints if retaliation is happening to get remedies. Also, it always helps when workers are able to act together. So if you're able to talk to other workers and join together to try to ask for changes collectively, first of all, it may protect you against that retaliation, but also it triggers other legal protections under the National Labor Relations Act, which most people think about in the context of unions, but you don't have to be in a union necessarily. It just means 2 or more people acting together, right, to try to address a hazard in the workplace that affects other people. You do have a right to report a problem to COEH. What we know in practical sense is that this is an agency that is very underfunded and understaffed. And so even before this crisis, that was the case. So it's not very realistic that they'll be able to be very responsive right now and in a timely manner. So for that reason, we're going to give you some other resources too. And another note is that, so COEH has kind of the enforcement arm, which can do inspections and assess fines and penalties on employers when they find violations, but they also have another arm that is for technical assistance and consultation. And so if there's an employer that really wants to do the right thing and they are just not sure how, they can request a consultation from this department and maybe get some advice about like, okay, what is it for your particular case? What is it that would be recommended? So that is in response to employers' requests, not workers. And then if you have a union, that is an excellent source of support, or some other worker or legal aid organization. Also, sometimes you need to put a little bit more pressure in getting some attention from other coworkers, from the public, from the media, online petitions, that kind of thing might be helpful. And then if you could also solicit support from your local or state elected officials. So we've seen lots of really great examples, and these are just a few of workers really coming together and taking action around COVID-19. And so one was, there was something like 50 Purdue workers that actually walked off the production line in Georgia. It's a poultry processing plant because they weren't being given enough protections. Also sanitation workers in Pittsburgh that refused to go to work until they were given protective gear. And the UFCW has negotiated many agreements with a range of supermarket chains and others, such as Safeway, about extra protections. Detroit bus drivers also went on strike and won some great protections. And then this is a very recent one, actually today, Instacart workers went on strike to also demand more access to several things, including wipes and sanitation materials. So Suzanne mentioned that we would have some resources. The main link at the top where it says LOHP.org and then COVID, that's where we update our resource list. And so, we're making an effort to focus on things that could be useful to workers, to worker organizations, anything with different languages. And we're trying to update it, as often as possible. So that's a great resource to go for some of the questions, especially that we won't be able to get to today. I think will be answered by a lot of the resources that are there. So check there, regularly. And some examples of the things you'll find are things that Suzanne referred to. So, OSHA has a guidance for generally for workplaces, but also some specific ones for particular industries. CalOSHA, if you're in California, also has the same general and for industries, the Centers for Disease Control. And for grocery workers in particular, West New York COEH had compiled a great list of recommendations. And we also have some resources there for safer disinfecting products. So just to conclude, this is a moment of crisis, and I think we can also see it as a moment of opportunity. I think what we're seeing now is, the situation has really exposed that there's huge gaps in worker protections. And something as simple as some workers just don't have the time to take a break and go to the bathroom and wash their hands, to even bigger structural things like paid sick leave. Also, we're seeing who's included in the safety net and who isn't. There's many workers that have been excluded all along, right? Domestic workers and day laborers and gig workers and many more. And so now when they need access to things like unemployment and disability and workers' compensation, right, we're finally starting to face that. Also, just such appreciation for workers that are essential to our economy, right? Some of the ones we talked today, but many other more. And, farm workers, food processing, transportation, home health care, garbage collectors and sanitation, just they've been essential all along, but it's nice to see that we're finally realizing just how crucial they are to the functioning of our day-to-day. It's really heartening for me to see this recognition that workers' health is public health. We're only as strong as the protections for our most vulnerable. When workers aren't healthy, they can't work, they can't care for others, and they contribute to the public not being safe. So, lastly, with these headlines and some others that I'm sure you know about and work that you're doing, just the role of unions and worker centers and other organizations to really help negotiate with employers and raise standards and think about all the social costs and benefits of current employment practices. Also there's been so much support for, relief funds for those that are losing jobs and volunteers. And someone mentioned the shopping times for seniors. So I think it's shown how we can really pull together even when we're physically distant. It doesn't mean we have to be socially divided. So hopefully all these things will make us more strong and more resilient for the future. And we're going to pause for just some last questions or comments that people want to make. So we'll go to Laura.
Yes, there's a lot of comments about hearing these recommendations, but recognizing that in their own workplaces or in the workplaces that they represent, these recommendations are not being followed, and what can be done, and who do they complain to, and what happens if OSHA doesn't respond. And so it highlights some of the points that were made earlier about the importance of working together with others in your community. And if you have a union or if you are a member of a community-based organization where people can gather together to try to articulate their demands and put pressures and others of the suggestions about being in touch with the community and the media to raise that issue and to continue to demand that your rights and your health are being protected, and to continue to fight together for what people deserve and need.
Mm-hmm. Okay, so we are in the final part. I know it's 1 o'clock, and I'm not sure, Laura, if you're seeing one or two questions that we should address. I think you gave excellent commentary to that issue and some of the suggestions that we're laying out for collective action, as you said, in this context that's been emerging in different work sites. Are there another couple of questions, or do we move?
I think that kind of covers it, and a number of people are wanting to be sure that they'll get access to this information. And as we've mentioned in the chat, it will be posted on the COEH CE website, and shortly it will be posted on LOHP's website as well, so that the slides and the audio it's being recorded so people can access it later.
Great.
All right, so just to remind you that we are repeating the same webinar in Spanish on Thursday, so please let people know. We have flyers on our website and here, and we can send you more if you need. And also, please feel free to follow up with us. We work with a range of unions and worker centers and community organizations and public health folks. And just to give you an example of some of the things we're doing now with our partners, in some cases we're helping them research answers to questions that workers are posing, or we're helping them develop fact sheets and virtual training for their members. So we would love to hear from you. If it's something that we can't support you with, we'll do our best to connect you to other organizations and other resources, but please feel free to reach out. And thank you so much for joining us today. My email and Suzanne's are here, as well as our webpage.
Yes, thank you, everybody. We really appreciate you joining us today.
And also from COEH, I wanted to thank everyone who joined us for today's webinar, and of course to LOHP for your valuable expertise and all the care that you guys show for the community. Be sure to check out our websites for more information. So that's coeh.berkeley.edu/aboutCE and LOHP.org. And as a reminder to everybody, an email will be sent out tomorrow afternoon with the webinar recording and those resource links. So thank you all again for the wonderful questions and participation in today's webinar, and have a great rest of your day.